Hi, Blooms. Hi, this is Eva speaking. Guys, thank you for the hearts. This is Eva from Barber Med Spa. I'm presently in Georgia in my Atlanta Lunar location, and I absolutely must speak about the subject for black women and black men because I have seen today one of the worst cases of HS, which is hidradenitis suppurativa, which comes from ingrown hairs. And I absolutely must caution, must warn every woman out there, every black woman, every black man out there, guys. This is a disease. Obviously, the disease affects white people, but it affects black people 10 times more than it affects white people. And the pain, the embarrassment, the discoloration, the surgeries that one has to undergo if you suffer from HS, and how to avoid it or how to reduce the problem. I have to discuss this with you guys. I wish I could show you a picture, but if any of you have a desire, just go on Google and Google black people and HS photos, and you will see what I'm talking about. What I have seen today, my heart was bleeding for this lady when I met her, because I could understand the pain and the embarrassment and the discomfort and the suffering that she had and she has because she suffers from HS. So I actually don't know how to show it to you, short of doing something unconventional, because I really don't know. I'm not technically advanced. I'm going to take a picture that's on my laptop. I'm going to turn my laptop in your direction. I'm going to show you a picture. I want you to see, and I can't do it any other way. Hold on, but this way. Hold on. If I can, oh, maybe yes, I can. I will show to you what it looks like and what I'm talking about, so everybody should understand how debilitating this condition is. So I don't know if you can see this. So I will bring it as close as possible to you. And I want you to look at the picture that I have here. I want you to look at the picture. And I will explain what you are seeing on the picture. I'm putting it to the second camera. Just look at this picture. And I will explain what you guys are seeing on this picture. This is an underarm. This is an underarm that of a woman that suffers from HS. So what is HS and how does HS work? So let's just understand this and why it inflicts black people. Oh, is this going to fall down? No. Why this inflicts black people more than it inflicts white people? For a very simple reason. Black people have curly hair. Sit there quietly. Black people have curly hair. Hi. So when you have black hair, when you have curly hair as a black person, hi honey, black hair that is curly, very often, instead coming out straight, it curls up because it cannot break through the skin, and it falls, curls up and goes back under the skin. Here is what happens with HS. I would say that at least 35 to 40% of black women are inflicted with HS because majority of black women get ingrown hairs on their underarms and get ingrown hairs on their vaginas, on their bikinis, between the butt cheeks, from the vagina direction to the anus, under the breast. These are very, very common places where black women get HS, Hidradenitis Suppurativa. And this disease has no cure, but it can be prevented. And this is why I'm cautioning every black person, I'm speaking to every black woman that hears me. Please just listen to what I have to say. I don't care how little money you have to do everything that you can in your power to gather some money together and start immediately laser hair removal if you're a black person. Because if you don't, so very often, guys, I said it's like 37 to 45% of black women suffer from HS. Now, in itself, if you have an ingrown hair, that will only hurt. Yeah, it will be only painful. That's all that will happen. You have an ingrown hair. It will then create a bump. Thank you for the hearts. It will create an inflammation. And then it will create a discoloration. Okay. But, and there is no understanding why this happens in black people. There's no understanding. Nobody understands. Nobody knows. What happens is that when you get ingrown hair and it sits there, very often the ingrown hair will make a tunnel under the skin. Thank you for the hearts. A tunnel under the skin, and it will go from point A to point B. So it will go this way, here and here, to this point, to this point. Okay? So between the 2 points, there is a tunnel. This tunnel that's created from internally under the skin, it's like, if you would take a Play-Doh, right? A Play-Doh, right? And you create a tunnel of Play-Doh, and the Play-Doh is wrapped around here, and then the Play-Doh comes to this point. Well, this tunnel is strong, and this tunnel creates tremendously painful infection, inflammation, swelling on the skin. And it looks like a keloid, but it's not a keloid. It's a tunnel from ingrown hair. It is HS. And when this happens, when it goes from here to here, it then creates pus. And the pus is where the hair started to come out and didn't come out. And then when it went to the second, so there's pus. Then there is pus across. And ladies and gentlemen, when you have pus, that's an infection, and it's very, very painful, even to the touch. If you have an acne pimple with pus, say aye. Now imagine that you have this in your groin. Imagine that you have this under your armpits. Now what happens, this gets bigger and bigger and bigger, more swollen, more, you can't even put your armpit down, you can't touch it because it is so very painful. If you get it between your butt cheeks, between the butt cheeks or in the direction of your anus, from the vagina going backwards, and that, by the way, happens in black men too. You get it on the pubis. And I actually have some videos. I actually have a very lovely black man that was very generous and let me videotape him and show his condition. And he also spoke about it and said how painful it is because he has this HS. It comes in men, it comes above the penis, so it comes on the pubis. Then it goes down between the thighs, under the testicle sac, all the way down to the anus, between the testicle sac all the way down to the anus. You have these huge abscesses and with tunnels. Then these abscesses, as they fill up, you can't sit, you can't go to the bathroom, you can't wipe yourself, you can't have sex, you can't wear clothes. These abscesses ooze, and then they blast open up, and dark blood and pus comes out of them. It stinks horribly because this is poison, this is toxin that's in there. It oozes blood, it oozes pus, and it is very painful. And you can have it anywhere. Now, as I say, you can't even move your arm. A touch is very, very painful to this. And when you come to this point where you have tunnels of HS, I cannot help you. The only thing you can do is see a surgeon. And then the surgeon has to go in and he has to open at the beginning, where there's a beginning here to here. He has to cut this open, excise, cut all this out with some flesh around it, cut it out, take it out, and then suture it up. This by itself, these forms, because it creates holes. So you get deformation on your skin. It's not smooth, but you will take the deformation better than you will take the pain and the discomfort that you have and the embarrassment that you have. Now, that's for your underarms, but if you have it in between your thighs, if you have it on your bikini, do you know how painful this is? How horrible this is? Can you imagine to have sex where something hurts you so much that any touch, any closest touch is excruciating? You don't want to have sex. Then forget about that. Add to that how badly you smell. The body smells. It's not that the person is dirty, but the pus, the toxic blood smells horribly. It smells like cadaver, like a dead body. It just smells, because it's decayed. Inside it's decayed. It's just horrible. And I've seen somebody today that came to see me, and I'm a strong person, but it sort of like grabbed me because I understood the pain that this person had, the discomfort that this person had. And so we opted to do laser hair removal. At least I do laser hair removal on the hair that is yet not infected, that doesn't have yet all these abscesses. The area where there are tunnels and abscesses, those have to be cut out. I can't help with that. I can only help with the other hair. But what I am trying to say to black people is this. Because black people, as a rule of thumb, are predisposed to HS more than any other kind of people because of the curly hair. To avoid this, and ladies and gentlemen, there's no cure. There's no cure, there is no medicine, there's no tablet, there's nothing that you can take to get rid of it. But the starting point, and that's the most important, the starting point is with the first ingrown hair that you get in your body. The first ingrown hair. And this is what I'm saying. Every black woman, every black man, every mother of a black teenager that starts to get some hair, and you say ingrown hair, do not wait. Put the money together. It's not the end of the world. It is a couple of $1,000s. It's not the end of the world. Put the money together and do the first thing. Do laser hair removal with the Nd:YAG laser. Because you can prevent everything else. You can prevent what I showed you earlier in the photograph. You can prevent the horrible, disfiguring, debilitating, painful condition called HS. If you do, yes, it's scary, if you do laser hair removal early on, you can eliminate it. And so if people say, Eva, what is early on? The first ingrown hair you have or your child has, run. Because an ingrown hair can switch in the body and become a disease called HS, Hidradenitis Suppurativa. Yes, prevention, of course, is better than correction. But nobody knows. Medicine doesn't know to tell you, okay, ingrown hair is only ingrown. No, they don't know how. We know that HS comes from hairs. That we know. But we don't know why some hairs will create HS and some hairs won't. So since we don't know, but we know one thing for sure, that it is the hair. So if we know the culprit of this horrible, debilitating disease, if we know it's the hair, then wouldn't it be smart to invest the money and get rid of the hair first? Get rid of the hair so you don't suffer from this condition, so you never come into this condition. I challenge every black person after you watch this video or whenever later on. I dare you and I challenge you to go on Google and just Google in black skin HS Hidradenitis Suppurativa, but just remember H like H and S like Sam, HS images. Ask for black skin HS images and you will see, and you will then say, Eva, you were absolutely 1,000,000% right. I just don't have I don't know how to do this. How to bring the pic. I just don't know how to do it, and I don't have anybody helping me here. If I was in Miami, I could ask my daughter or somebody else to help me to bring the pictures up. So that's why I just said, like, so stupid, bring the laptop and show you the picture, which I did before just from my laptop, because I don't know how to bring it to here. However, I challenge every person to go and look at Google black people, black women, black men HS photos, and you will see what I'm talking about, and you can hear stories. Thank you, Elijah. I love you. Thank you. Then you will hear the stories. So if you don't take my word for it, just take my word for it and just Google the photos and look. And when you see it, then you will say, oh boy, this is horrible. This is only visual horrible, but just imagine how much pain a person has when you have it under your armpits, you have it inside your bikini line, you have it between your tush, you have it on your tush, on the cheeks of your tush. You can't sit. You can't sit in a car, you can't drive because the pain is excruciating. You have to wear these thick pads of cotton, gauze, everywhere you have, because at any time it oozes blood and it oozes pus. And at least you get a little cushioning because, again, I say, even if you have just one pimple from acne and you touch it when it's inflamed, it's eye. Now imagine if you have such big things and they are all across. So I am saying, like Elijah said, prevention is better than correction. I can only help people when they're in the beginning stage with HS. So HS is basically 4 stages, 1, 2, 3, and 4. If you reach after stage 2, already stage 2 is bad, but we can still work with it. I can't help you if you stage 3 or stage 4. I cannot help you. When you reach stage 3 and stage 4, the only choice you have is surgically. Every couple of months, you have to go to the doctor, you have to go to the hospital, and they have to cut them out. It's a surgery, and it leaves scars. Because it leaves holes. Because when the doctor excises the whole canal that is under the skin, he has to cut out the canal, that was connecting between the two heads, one here, one here, and then he has to cut this and then this. So he has to cut all of this. Then it creates a hole, right? It's an empty. And then he has to sew it up. And these scars look awful. And it's scar on scar on scar on scar. It never stops because you have 1,000 hair follicles in your body on a square inch of skin. We all have 1,000 hair follicles. Now, not all 1,000 are active, but enough. If you have 100 active hair follicles and 40 of those are in the HS condition and they are ingrowns, your life is a total misery. And I promise you that sex will be the last thing that will be on your mind, that you will never undress in front of your partner. You will always shy away because you stink, because you smell, because the blood smells horribly. and it's, you are not dirty. It's not that you are dirty, but this disease, it's decay, like decayed flesh, like a dead corpse. It smells. It's over. That's exactly because it decayed. It's decayed flesh under the skin, and it's all from the curled up hair. So there is no cure, there is no solution to prevent it. The only thing that can prevent it in black people, and white people too, but I'm talking to black people, is the Nd:YAG laser hair removal. So if you're in stage 1, if it just started, make an effort to come to see me or see anybody that specializes in black skin and uses the Nd:YAG laser and understands how to treat HS. Because if it's just the beginning stages, it's fine. But if you, for instance, already at stage 2, you already have big wounds, and you have to know how to treat, how to do laser. And that's more complicated. So you have to be experienced like myself to know how to actually use the laser when you are treating somebody with HS, and what needs to be done with the skin, and what needs to be done before, and what needs to be done during, and what needs to be done after. So it's guys, it's just, I have in front of my eyes the picture of this person that was here this afternoon. As I said, I'm tough, I don't cry, but I cry inside. I cry for this person because I feel so much empathy for this person. And they found me already when this is advanced stages. So to treat, I have to treat, and this person actually works for a living as a driver. And I mean, just to explain you that it's on her tush and it's in between the butt cheeks, how painful this is, how horrible this is, how hard it is for this person to work, because it's so painful to sit on the tush, to drive, but she has no choice, she has to. So it's just a very debilitating disease, and there is no cure. It cannot be stopped. It can be prevented insofar that black people on the areas of underarms, around the breast, under the breast, if you have fat, belly fat, it can happen under belly fat. In particular in women, under belly fat, it can happen under the belly fat, in between the thighs, on the groin, around the anus, on the butt cheeks, and men have exactly the same thing. It happens on the same areas in men, underarms. So I have several videos with this black man that allowed me to. Okay, I will answer this question that allowed me to take videos. So somebody's asking, how long does it take for HS to form? It can be overnight. Nobody knows, because the medical industry doesn't know how HS comes. We know that it comes from hair, but none of us are God and none of us have X-ray eyes. So I cannot tell you that it happens after 2 weeks. Not possible. Because nobody knows why it happens. Why for some black people it doesn't happen, and why for other black people it does happen. And you can take 2 black women, 2 vaginas, 2 bikinis, 2 inner thighs, everything similar. And one will have it and one will not have it. So there is not to say one ingrown hair can cause it. One ingrown hair on a black person can start a chain of events of HS. One ingrown hair. So people should not wait, because I don't have a logical explanation. There are things in my mind that say that maybe there is a correlation, that maybe there are some triggers that when the first hair that gets ingrown in a dark person, and then suddenly it creates pus and it flips into becoming a condition of HS, that maybe there are some signals on a transcellular level in the body, and maybe then these signals are converting something inside the body, and then then these signals send these signals to every hair and every ingrown hair, and then automatically every hair that becomes ingrown becomes an HS hair. Yes, the best prevention for eliminating HS is laser hair removal. This is why I said, if you are a black person, if you are a black mother of a black girl or a boy, no, never mind what, don't spend money for 1 year on bullshit. Just save the money and do the laser hair remover. Just put the money for the laser hair remover. As I said, it's not the end of the world. Like, if I did a bikini, right, and I go all the way down to anus, so if you prepay for it, the whole thing would cost $2,100. This is not the end of the world, and you require many treatments to do this. But it's the best spent money in the world. If you spend $2,100 or $4,200, because let's say you do bikini, you do underarms, you spend this money, you're investing in yourself, and you eliminate the possibility of HS. Is there a price? Is there a price that you can put on your well-being, on your life, on a painless life, or the normal life? Like, is there a price that you can put on something like this? I don't think so. I guarantee you that any person that today has stage 3 and 4 of HS, they wish they would have known about me, they would have known about the treatment, and they would have spent $100,000, not $42 or $2,100, to get rid of it before they get into the condition that they are in. Because I believe that once the first HS starts, I believe that it's on a cellular level. There are some triggers internally inside the body, go to the brain, then from the brain, something. It's science, didn't figure it out. But I believe that that's how it happens. Because once you get one HS hair, that's it. It just comes. And so then and you can't know until it happens. So this is why I say, if you have pubic hair, you have underarm hair, like, don't spend money on nails, on wigs, on that. Spend the money, get rid of the hair. That's numero uno. 2, the first ingrown hair you have. Don't play Russian roulette, because the first ingrown hair can be the culprit, can be the one that will cause you the rest of your life of suffering, because it's that one hair that will switch, somehow flip and become an HA hair and condition, and then that's it. It's like, because it just like multiplies, so it affects every hair follicle in the body, or most hair follicles in the body. So this is why I think prevention in black people is so much better than correction. Because as I said, I can help you if you're in stage 1 of HS, and there are 4 stages. If you're in stage 2, we can work around it. But if you go to stage 3 and 4, there's nothing I can do. The only person that can do is a surgeon, who will cut it out, and it will be for the rest of your life. And you will be miserable for the rest of your life, because this will come and come and come, and it will never stop. Never, never, never. So, laser hair removal is the answer. The young laser hair removal is the only answer. to prevent it. I remember like a couple of years ago, I had a black guy that came to see me, and he came to see me because he had a problem on the back of his head. He had these scabs, and those scabs obviously happened from the barber. But that's a completely different topic. And so he had all these scabs, and he saw a video of mine years ago with a black man that I don't know, it came from Detroit or something. He flew to Miami, and he came to me. After 15 years of suffering with these scabs that he had, which obviously started from a barber, and then he had just scabs and scabs and scabs, and he was doing all kinds of funny things to get rid of them. But he couldn't get rid of them because it's sort of like multiple. And anyhow, he flew to see me. And when he took off his head, he said, okay, let's do laser. And I looked, I said, I can't do laser. I don't see any hair. I said, your whole head is full of scabs. So you have like 3.5 hair. I said, I can't do laser. But I gave him, he bought, I think, 2 jars of my oxygenated ozone serum. And I said, use this on your scalp. And he did. And within a month and a half, all the scabs came off. And then he saw a bald head. But he created a damage because he tried to do, and so he used all kinds of chemicals, and he burned his skull. So he had a crown like this, a black man. All this was white, because he destroyed the pigment. And then everything in the back, which we couldn't see, now that was darker. So he had no hair left because of the scabs and the wounds and everything that he was doing. But I made a video, and then I think we made a video with him. I showed the pictures of him, and then his success insofar that my ozone serum was the only thing that helped him, and then got rid of the scars, got rid of the wounds because it's an antifungal too. And then he had a clear scalp, and he knew that he didn't need laser because he didn't have any hair. And this man in Atlanta came to see me, had a similar problem in the back of the head, and then he got the ozone from me too, and we talked, and I explained him why the problem is with the barber. What happens when you go to the barber to as a black man. And then we were talking, and then he said to me, he said, I have a brother and I have a sister-in-law. And he said, I have to send my sister-in-law to you. He said, it's embarrassing. He said, but my brother cannot have sex with his wife, first of all, because she's in so much pain. She has it everywhere between her legs, on her vagina, or under her breast. She's probably overweight. And he said, and she smells horribly. And my brother can't touch her. And I understand it. It's, like how can you go to bed with something that smells, which stinks, that's unpleasant to start with. Then if something smells and stinks like a dead body, like a cadaver, that's even 10 times worse. But put that aside. The pain that the woman has, any touch that you make. So I actually sent him to Atlanta to see a surgeon. I said, I can't help her because she's in stage 4. There's nothing I can do. It's too late. But I'm just telling you that this is such a terrible disease. And again, nobody talks about it because there's a taboo. And a lot of people are very embarrassed to talk about it. A lot of people will not talk about it, will not say that they have this because they're embarrassed. It's a taboo. Like once upon a time, people were not talking about breast cancer because it was a taboo. Now they talk about breast cancer and one day they will talk about HS. I start this wheel to go, and eventually I believe that there will be other people that will eventually jump on the wheel and talk about HS. But all I can tell you as a human being, not even as a professional, as a mother, as a human being, as a woman, that it squeezes you hard when you see a patient come to you, whether it's man or woman, it doesn't matter. because pain is pain, it's equal to anybody. And you see these debilitating conditions, and and when these abscesses burst, they actually leave a hole, like an eighth of an inch hole when they open, because inside is so much pus, so they leave, it's in a hole, it's like a big hole that they leave, and you're full of holes and full of abscesses, and then full of these canals that you have been, oh. It's a very bad condition, but it can be stopped and eliminated if you start laser hair removal as the first thing in your life when you start getting hair. That's why I said mothers. If you have children, because listen, a girl can be 14. Today, girls at 14, they are developed like they are like 20 years old, and they have on pubis, and they have HS. They have ingrown hairs. Don't wait. I treated in Miami several young girls. But they came several years ago to see me. And some people came actually, several people came actually before COVID, and we stopped during COVID. And I actually have a video with a black girl when she speaks. And she tells how terrible it was, and how much bad we had to stop during COVID, and a grandmother died for COVID. So she didn't come for several years. And I was on top of it. I said, kiddo, you paid, and this is so painful. Don't wait. And then she eventually came back. And we are doing laser, we are doing the mini Eva skin lightening kit, because it's also antibacterial. And so in the combination, she's 60% better. 60% better. But she will need me for years to come, to do laser hair removal, to constantly kill any hairs that come, so she doesn't get more boils and she doesn't get more HS. I will tell Elijah, I will tell you something, and whoever listens now and later, about barbers. I made the video about it, but just so you understand what the problem is for black men. So black men are usually very devoted to the barber. They go to one barber and then they stay with that barber. But here is the problem. So as ingrown hairs for women on the face is a problem, in black men, hair on the back of the head is a problem, and I'll tell you why. Okay, so go on the channel and watch the video. But here's what happens. Let's say I have an ingrown hair, I have a wound on my skull. I'm a guy, I go to the barber. The barber takes the clipper and he cuts my hair. And today, black men have all kinds of designs in their hair, and they cut short. And when he cuts and goes with the clipper, in between the teeth of the clipper, as he cuts, some of the bacteria of the pimple of the ingrown hair goes in between the teeth of the clipper. A barber, nobody can take a clipper, take it off and put it in the disinfectant blue solution. You cannot do that because the clipper will rust immediately. So in the best case, a barber will wipe it, clean it, and next one. But he doesn't clean in between the teeth. So now comes Elijah to the barber. And in here, in the clipper here, is some bacteria and some pus. And Elijah has a little cut on the back of his head. And now the barber takes the machine and he cuts Elijah's hair. Now, where there was a little wound that Elijah had, the bacteria and the little pus that was on the clipper now enters, hi Sylph 69, hi, enters Elijah's scalp. And now that bacteria, that pus will create additional wounds in hair follicles. Not HS, but additional wounds in Elijah's head. And suddenly Elijah will get a wound and then another wound. So, but it is not the fault of the of the barber, because as I said, you cannot immerse the clipper in the solution. So what I said is the easiest solution for any black man or black mother or black boys. You go to the barber, because I said black men are usually going same barber. So you go to the barber and you say, hey Joe, what is the name of the machine? So he will say, soldering and whatever. So then you will say, okay, write down the name of the machine, right? And then you will say, Joe, how many different clipper heads do you use when you give me a haircut? He says 1 or 2. Most of the time, 1 or 2. Maybe 3. But, I'm not a black man. I don't know, but I assume. Why I assume? Because I cut my dog's hair, and so I usually switch between 2 clipper heads. A little bit shorter, a little bit longer hair. So I think it's the same thing on human hair. So you say, okay. So now it's 2 clipper heads. So you say, what is the number of the clipper head? So he will say number 7 and number 10. I'm just throwing a number out. So then you go to Amazon and you say, okay, Andis, because let's say the barber said his machine is Andis. So you go to the barber, to Amazon, and you say Andis clipper heads, and you will get a lot of different clipper heads. And then you say clipper head number 7 and clipper head number 5, number 10, whatever the barber says. And you buy one of each. And then you also buy a bottle of spray, Fallujah High. You buy a bottle of spray, an antiseptic sterilizing spray. It's like a blue bottle. You buy it with the 2 clippers. You don't buy the machine. You just buy the clippers. The reason you ask for the brand of the machine, because every brand of machine has its own brand of head clippers. Now, you take these 2 clippers that you have, you put them in a Ziploc bag. Usually black men have a car and they go to their barber by car. And if you don't go by car, well, then you take it from your house. But if you go by car, you put this Ziploc bag with these 2 clipper heads in your glove compartment. I don't know how often black men go to a barber. I have no idea. But you have it in the glove compartment. So whenever you stop by the barber, you take your 2 clipper heads, and when he comes to cut your hair, you say, Joe, here. Okay, here are my clippers. Take off your clipper, put my clipper on, and cut my hair with my own clipper head. And when he's finished, he takes it out, because putting the clipper heads on, you don't have to screw anything. Today, you just snap it on and off. And then he gives you back the clipper head, then you give him the other one for the design, whatever you do, and then he gives it back to you. Like this, you will never get an infection. You will never get somebody else's bacteria on your skull, inside your head, because you are using your own clippers. And then you have the spray, and you spray the comb, the clippers, you spray them and dry them with a clean tissue or paper towel. You spray them well, shake them, dry them, and put them back in the Ziploc bag and keep them in your glove compartment or wherever you keep them when you go to your barber. And like this, you will avoid the problem forever, because you're using your own clippers. So as I said, it's not the barber's fault, because you really cannot immerse clippers in any caustic solution. Not possible, because they will rust immediately. So, and for a barber, he only wipes it. He never can go in between his teeth. What did you comment? I don't see joined. I don't see what you commented. It cannot do it in between the teeth. It's not possible. Like you would stand there for 10 hours cleaning it. So this is the solution that I had for black men and black mothers of black boys. When you go to the barber, that's how you solve you solve that problem. So you don't get these scabs. But if you already have scabs, and it's for a while, you most likely have no longer any hair there. So in that case, you come to see me. I analyze what you have. We first treat you with the oxygenated ozone serum. We get rid of all the scabs. Then I analyze. And if you're like a leopard, like a leopard, and you have some hair, some no hair, some hair, some no hair, then I say, okay, let's do laser hair removal on the hair that you still have. But because it's blotchy, you don't have a full head of hair. You have some hair, it looks like you are sick. So then we do laser, and I get rid of the hair that you have. And barbers can make today designs, because usually it's in the back of from the crown of the head down where the problem is for black men. So when you uh, have this blotchy, yes hair, no hair, and I do laser hair removal on the areas that you have hair, I even it out. So let's say you have no hair in the back of your head, but then you have hair here. So the barber can make you a design, whatever, with your hair. Or you can shave your hair completely. But for that, again, I have to see what you have. And I will not do laser just because you want me to do laser. I first say for black men, when they have these scalps, let's heal the skin first. Let's take a month. You use this treatment, and then you come and see me again. And then I will see what condition your scalp is, and if there is any hair that it is worthwhile lasering off. So that's the story. Guys, Fallujah, I saw that you said that you sent me a message, but I don't see the message here on the feed, so maybe it's somewhere else. I am going to go now because I'm very thirsty. So I said my piece. I shared with you. Elijah, darling, you know how to repost this, because this won't be here tomorrow because I'm talking like 47 minutes. So this won't be here, but whoever saw it today, guys, just share this video with other people, because you're doing other people favors. If you share this, and if you can get and solve or help another human being, another black person that suffers from HS or is at the beginning stages, or you can prevent them from suffering from HS, you did God's work. So that's all I can tell you. And yes, I am very disturbed by what I saw today, and with this patient that came, and my heart is breaking for the patient, but it is what it is, and it's very debilitating, very painful, very embarrassing. You cannot work. It's very, very hard, and you have no life. Your life revolves around your wounds, around dressing them, and you have to change this dressing several times a day. It just, listen, I've seen many people with this, and I've seen people cry bitterly because they are fed up. Young women, they're fed up. But even then, stage 3 and 4, there's nothing that can be done short of doing surgeries, and then maybe doing laser around the area that where there is other hair, so maybe you don't get as many of these HS hair conditions, because we will kill the other hair follicles. But I have to see. So anyhow, guys, anybody wants to talk to me, 305-864-3333. I'm leaving Sunday back home to Miami. So I'm in Georgia. If you want to talk to me, maybe I can even schedule a consultation. Give me a call, and otherwise I'll see you the next time. Thank you for the hearts. Elijah, I love you. Thank you. I hope you're doing okay. P.S. Just on a short note, I just about an hour ago got a phone call from the county here, a warning that there will be very, very cold weather, very freezing weather. So anybody that hears me that is in Georgia, and I'm talking now to my friend Elijah, stay indoors, because first of all, it will be very cold, so it will be frozen. Monday, there's going to be snow. But if it's going to be very cold, if I got a phone call because the pipes are going to freeze and they let people know to take precautions, so just I know you're here. Just stay warm, stay in your room, and get some food so you don't have to go out, so you don't fall down and God forbid break your head or your knee. Because ice is ice. It's not fun. Okay, guys, thank you very much. Love you all. Thank you. Appreciate. And anybody has any questions, you can DM me. Yeah, DM me, or you can email me to medspa33154@gmail.com. Thanks, guys. Bye, Eva. Ciao, ciao. Bye, Elijah. Bye, bye, darling. Bye.